Hello, I'm Dr. Marc Gittelman of Uromedics and Optimal Health Miami, and today I will be discussing how we obtain your lab values so that we can fine-tune your testosterone dosing. No matter what technique we decide on to supplement your testosterone, it will be essential to monitor your blood levels periodically while you're on testosterone therapy. If you're on testosterone injections given weekly, we typically make your injection day a Wednesday. The rationale for this is that you'll tend to peak 2 days later, which will be Friday, Saturday, and that's typically the time when you're more likely to be sexually active and more likely to be athletically active. Now, Wednesday is not set in stone, so please let me know if, for example, your Wednesday to Sunday is your work week, and we can actually change things around a little bit for you. But if you can do it on a Wednesday, I think that would be ideal. So let's take a look at a graph of someone just like you starting on testosterone. So you're typically starting off somewhere down here in the suboptimal level, and on your first shot, we'll try to get you to the 70 to 80th percentile. Then as the testosterone leaves your body, you typically go back down to your low level by day 10 or so. But instead of allowing all of the testosterone to leave your body, we will have you supplement yourself again at day 7, the next Wednesday, and let's see how those levels will begin to come up again. Inject on a Wednesday and up by Friday, Saturday, down a bit by next Wednesday, and then inject again, etc. So what we would like to do is know your level just as the testosterone is wearing off, and that's called a trough or a valley level. That would be on any given Wednesday just before your injection. Then you take your injection, and in 2 days you'll go to the lab on a Friday, and that will be your peak level. I will then be able to recreate this curve as it applies specifically for you. And then I will do some fine-tuning. So the first set of lab tests will be in 4 weeks. Once again on a Wednesday before your injection, then you give your injection that Wednesday, and you'll head to the lab again on that Friday for your peak. And don't worry, my staff will go over all of this again for you and tell you which lab to go to if you're not familiar. Once we fine-tune your levels, we really only need to check your labs every 3 to 6 months, depending on your age and other factors that I like to watch carefully. As part of those labs, we'll also be checking routine labs such as your PSA and CBC, which is your complete blood count. We recommend checking your cholesterol and a general metabolic panel at least yearly. If you're on pellet therapy, that's the slow release injection that lasts 3 to 4 months, then we check your peak levels at 1 month and we check the trough levels at 3 months so we can fine-tune your dosing as well as your timing between pellets. Once we determine your dosing and interval, we will get what we call safety labs a week before your pellet insertion. We recommend checking a lipid panel and a metabolic panel at least yearly. If you're on topical therapy, that is a gel or a compounded cream, then we will check your level at 1 month and we'll see if you're absorbing the product or not and if we need to fine-tune your dosing at all. We will check safety labs every 3 to 6 months and a lipid and metabolic panel at least yearly. Many people ask me, when will they feel different on testosterone? Well, that's very variable. Some people will feel some improvement literally in the first few weeks, but others will take as long as a few months. Testosterone is not like dynamite. It's very, very subtle. Remember, your body's been making testosterone since age 12 or so when you entered puberty. It then actually maxes by age 20, reaches its maximum level, and it slowly declines at about 1 to 1.5% per year. So when we replace it, your response is likely to be subtle. After a few weeks, you may notice improved energy, better stamina in the gym. Commonly, people feel higher libido and improved morning erections, as well as better sexual performance in general. Still others notice improved concentration or better quality sleep. I recommend a trial of 3 months to determine if you're reaping the positive benefits of testosterone therapy. No matter what type of therapy you decide on, my goal as the head team member at Optimal Health Miami is to maximize your response to testosterone therapy in a safe way. We want to be sure we're reaching the goals that you would like to achieve, whether it's increased energy, weight loss, improved strength, or enhance libido and sexual performance, we will work with you to try to achieve the endpoints and goals that you desire.